This video demonstrates the technique of performing pinhole pupilloplasty. This is the pentacam image of the patient, and the patient has a higher order aberration. The normal aberration that the patients can tolerate is up to the value of 0.3, but this patient had higher order aberration ranging more than 2. These patients are never happy post-surgery because of the induced aberrations, and this forms one of the most important clinical conditions for performing a pinhole pupilloplasty. In this case, cataract extraction is done and intraocular lens is placed into the capsular bag. Pinhole pupilloplasty works on the principle of small aperture optics. That is, the pinhole, it imparts extended depth of focus post-surgery, and it also provides the extended range of vision. This is what actually helps the patient in the post-operative period. But actually, to perform a pinhole pupilloplasty, the first requirement is that the surgeon should be well versed with the normal pupilloplasty procedures. And the second thing is that usually these patients, they need a multiple quadrant approach. And it may be that during the surgery, the surgeon might need to perform pupilloplasty procedure at least 3 to 4 times, because it's very important to close down the pupil from all the sides. The second most important thing while performing a pinhole pupilloplasty is that the centration of the pupil should be appropriate, and it should be centered around the Purkinje-1 reflex that comes from the light of the operating microscope. Now, in this, you are just seeing the triad of the light which is seen in the center. That's a Purkinje image. It's a coaxial illumination of the microscope. So the surgeon needs to center the pinhole around this Purkinje image. The Purkinje-1 reflex is the marker for centration of pinhole pupilloplasty. Many times what happens is that when pinhole pupilloplasty is done, the iris tissue overrides the Purkinje image. So when this condition arises, the easiest way to target the Purkinje-1 reflex onto the center is to use a vitrectomy probe, and the surgeon can cut down the iris tissue which is trying to obscure the reflection. Having done that, pinhole pupilloplasty works really well, and this is the post-operative image of the patient.